Good afternoon. Thank you for joining us today. Not only am I the last presenter of this virtual conference, I am also the only non-medical team member representing NextGenFace, a nonprofit founded by Dr. Charles Thorne, Chair of Plastic Surgery here at Lenox Hill Northwell Health. NextGenFace is an extension of the medical team. We help people with facial differences. We provide funding for expenses not covered by insurance, such as housing and transportation. Very often, people with craniofacial conditions, whether congenital or acquired, require comprehensive services and surgical procedures throughout their lives. Abnormalities can impact speech and articulation, eating, hearing, self-esteem, and the overall human spirit. We promote positive public awareness of facial differences, helping families locally, nationally, and internationally. Nothing beats parents speaking to parents about craniofacial conditions. Family support is incredibly valuable. We network families regarding pre-op and post-op surgeries and procedures. When a child is born with the facial difference, parents need information. They need support to empower themselves to successfully manage often complex craniofacial conditions. Today, you have heard from several specialists from the NextGenFace team who treat and care for our patients while providing support to their families. Today, you've heard from several specialists from the NextGenFace team who treat and care for our patients while providing support to their families. Team members often include surgeons, plastic surgeon, oral maxillofacial, and a neurosurgeon, a prosthodontist who makes prosthetic devices for the mouth, an orthodontist, a speech and language pathologist to assess not only speech but also feeding issues, an audiologist to assess hearing evaluations, an otolaryngologist, psychologist, ophthalmologist, geneticist, and nurse specialist. Today, I would like to introduce you to a couple of patients who have been treated by the NextGenFace team. Meet Taina. Taina is 17 years old. She has undergone several surgeries and procedures at another facility beginning at 4 months of age. She has several conditions, including a cleft lip and palate deformity, a rare craniosynostosis that affected the shape of her skull. For the past 3 years, Taina and her family have been meeting with members of the NextGenFace team to plan a complex and risky surgical procedure, a bipartisan monoblock distraction, which would be inserted in Taina's skull. The NextGenFace team virtually planned her surgery. This past July, she underwent the procedure. Her parents turned the device for almost 3 weeks. In November, she had her device removed. She has now recovered and after successful procedure with no complications. It wasn't just about her appearance. There were functional components to having the surgery as well. She can breathe better, no sleep apnea. She can eat better, her teeth fit together, and with no more underbite. Her eyes are now protected and will not dry out. She has 2 more surgical procedures scheduled, a rhinoplasty with Dr. Jim Bradley and a pharyngeal flap for speech with Dr. Steve Warren. Taina's care throughout her years included a plastic surgeon, a neurosurgeon, a prosthodontist, an orthodontist, and a speech pathologist, to name a few. NextGenFace provided support to Taina and her family throughout her surgical procedures and extended care. Here you see Taina after her surgery. She loves playing the piano, and she's ready to apply to colleges, attend her high school prom, and graduation with the goal of becoming an occupational therapist. Another differentiator between the medical team and me is that I'm the mother of an adult who was born with craniosynostosis, fused bones to his skull, also known as plagiocephaly, and hemifacial microsomia. Christopher's right eye, the whole right side of his face was affected, including his eye, his jaw, and his ear. He does not hear on his right side, and his vision in his right eye is compromised. The prevalence of his craniofacial condition is 1 in 3,000 to 5,600 live births, the second most common craniofacial condition to cleft lip and palate, which is 1 in 600 births. Christopher has benefited greatly from the team approach. He is 33 years old and has endured 33 surgeries and procedures. Beginning at 9 months old, Christopher underwent a craniovault remodeling for his craniosynostosis and plagiocephaly. The plastic and neurosurgeons reshaped his skull, allowing for proper brain growth. In 1989, Christopher was the first patient to undergo osteogenesis distraction at 22 months of age. This was distraction of his mandible. After the device was inserted, we turned it for 1 month, lengthening his jaw by almost an inch, creating a gonial angle. During his grade school years, Christopher underwent 4 stages of ear reconstruction. His ear was constructed from cartilage from a rib taken from one of his ribs. As an athlete, Christopher always took time off from surgeries to enjoy his time on the lacrosse and football fields. As a young adult, Christopher underwent 2 major surgeries, a Lafort of his jaw, which required months of pre-op orthodontic care, and a microvascular free flap. Throughout his young life, Christopher has benefited from the care he received and continues to care from the NextGenFace team. Their coordinated approach and comprehensive care has allowed my family and I to successfully manage Christopher's craniofacial condition. Christopher graduated from Fordham Prep and is currently the Director of Corporate Partnerships for the New York Giants football team. I hope my presentation today has provided an overview of the NextGenFace team and the exceptional care that they provide for our extraordinary families. As the director of NextGenFace, I am committed to working with the medical team to ease the stress of managing craniofacial conditions while providing a spirit of hope, support groups, networking, and ultimately helping them navigate their journey. Thank you for joining us today.